The RVA Business Talk Radio on ESPN 106.1 FM, The Choice 105.3, and worldwide on IBGR.network. Would you join me, please, and welcome me, Mike King Biz Radio.
Ladies and gentlemen, welcome back to On the Mic with Mike. It is the premier business radio program around. I'm the host, Mike King, and I appreciate you being here with me. The views expressed here in mine have no connection to, support of, agreement with any other host. The information or ads on the station that you hear me on. I don't work for those stations. My program airs here on a daily basis. Join me on this cutting edge show as we uplift the community and showcase RVA in a different way. Sounds we're listening to today are coming to you from the Common House, 303 West Broad. It is the premier social enterprise, co-working social club in the area. Our good friends here take really good care of us. We'd like to thank our show sponsors, Tom Chody, the credit card guy, Andy Taylor, and Junk Pluggers. If you have things around the house that you need removed, give Andy Taylor a call. That's things, bikes, hot tubs, lawnmowers, sofas, pianos. If you have people around the house that you need removed, don't call Andy Taylor. He will not, even though he is the sheriff, don't call him. Stop cooking, stop giving out gas money, change even our password, something. But Andy Taylor and Junk Pluggers do not help you remove people. They're eco-friendly. They got lime green trucks. They're totally community-based, but they can't help you to have your son, daughter, or friend, or husband, wife leave. So don't give them a call for that, but give them a call for everything else. Mama Shell's Cafe. It is our good friend. We're back. Friends of the program come back here. We got a good friend from Poplar Springs Hospital. We got Kent back in the building. But Kent didn't roll solo this time. The last time you saw Kent, we were in the ESPN studios. But now, Kent came back, not rolling solo. Kent, welcome to the program.
Thank you. Glad to be back.
All right, so Kent, who did you bring with you today?
Oh man, I have my colleague. I'll let her introduce herself, Sarah.
Good morning. Thank you for having me here, Mike. My name is Sarah Brown, and I am director over at the Grove at Poplar Springs. And thank you for having me here today.
We've been hearing a lot about the Grove, this place, the Grove.
Yeah.
So we got the lady here today. All right, before we get started, Kent, give us the, normally it's Lamar who gives us the elevator pitch for Poplar Springs, but you're here, sir.
Sure. So again, I'm the chief nursing officer for Poplar Springs Hospital. We're a 200-bed facility, a freestanding behavioral health hospital with an array of behavioral health services. We have acute adult services, inpatient services, people who are in behavioral health crisis, stabilize them so that they can transition to a lower level of care. Once they're stabilized, sometimes they will see Sarah and go to the PHP IOP program for continued therapy and support. We have a residential treatment center for adolescents, and we have adolescent services. As you know, finding services for adolescents are scarce, but we're happy to announce that at Poplar Springs, we do have acute inpatient behavioral health services for our adolescent population.
So you guys, as you always say, you meet people where they are.
Yes.
At all levels, whether it's by phone, people coming into the facility. You also have a night program, an evening program.
Yes.
Yes. Sorry about that. Yes, we do. We have started our night or evening IOP program. It starts from 5 in the afternoon to 8.
I'm sorry, what's an IOP?
That is intensive outpatient program. This is a program that is used by individuals that don't need like a 5-day program or intensive hospital program. Okay. So they can come there and do groups, and they have those groups for 3 days a week. And so you have some in the daytime. So our normal IOP groups is from 9 to 12. So that's 3 hours a day, Monday, Tuesdays, and Thursdays. So we're starting our evening IOP for those people that want to go to work. They have to go to work to make a living, but they do have some stress, some anger management, maybe some depression, some anxiety going on. So they want someone to talk to and want to have that whole array of support. From our licensed psychiatrist to our nurse to our social work, and they can come there in the evenings from 5 to 8 in the evening.
Mike is here, Sarah, as well as Kent. So, Sarah, the people who are in that IOP, do they go there? Do you see a higher number of people who go there on their own as opposed to somebody telling them they need to go, like the intensive program? Do you see a higher number of people saying you got to go over there as opposed to the people who come into, they kind of think that they need some help, and they want it, but maybe somebody's not telling them, they know it on their own.
Well, most of my numbers are coming from individuals that's being referred. They are coming from their therapists, the individual therapists. And most of my clients consist of patients. They consist of people that's working. It's difficult out there in the world now. So a lot of people that in their job settings, they have to change their life. So the adjustment period is just ridiculous for them. So they're having a difficult time adjusting from going to work and then or staying at home working. And I'm seeing a lot of a high level of stress, a high level of anxiety. So we're having a lot of, I call them EAP people coming in. You know, they're going through their company insurance and they're coming in and doing these groups in the daytime. So therefore, we see a need for IOP people in the evenings that want to work, that have to work, you know, to make a living, but they still want that. And those are the people that want to come on their own. So we also have a group of people that is stepping down from our PHP program. So what we do is when they step down from like a hospital stay, inpatient, they will come in and my first thing is to get them stabilized. Let's come in, let's set up your treatment team meetings, let's set up a program for you, you know, a treatment program, and we get you stabilized. So we go through the PHP program, which is 5 days. And after those 5 days, we will go back to the table and then assess, and everybody always are involved in their treatment to say whether they're progressing or not, or what they need. So they will go in there, and then we'll step them down to an IOP program, which is 3 days. So that way, give them that authority of, I'm getting better, I'm doing better, and this is what, you know, and giving them that hope that they're doing better.
I would bet that part of it from the medical perspective, giving them that hope that I am progressing, I'm getting better. So I'm going from in-house, I'm going to 5 days to 3 days. I can see, because I would guess that if you didn't know what you're working towards, it would be hard, because how do I ever know when I'm going to be better to the point where I can leave? So a lot's going on in the world. Sarah, let's talk. I always ask people, how are people doing? When you see people as just a regular lay person, you know, you're a person. You also see people as the clinician who's out there looking at them saying, so ma'am, how are people doing in the streets?
Well, what I am seeing is there is I want to make this as a move towards Kent, okay? Because I want Kent to talk more about this. There's more depression and anxiety. There's a rise in there. So I want to let Kent continue on with this conversation.
So Kent, and I know we had talked before, and I think when we were here last week, we talked about from the military aspect, and people always talk about, boy, you know, the holidays are rough, the holidays are rough. And then what happens when the holidays are over? Like, what do people do? I know we're still struggling, and I know that's what you want to talk about, the struggle of depression as well as a suicide, because it's back in the news. And it's bad because it's back in the news because somebody high profile did it. But all of a sudden, there are people every day who are struggling, and you guys provide the hope for them. So it's Poplar Springs here talking about the serious subject, but they're also giving solutions to it.
So I just want to say, you know, every day, again, I'm the nursing officer for the hospital. We do see increasing numbers of people coming in for depression with suicidal intent. So these are people who, for maybe 2 weeks or longer, have languished in a depressed state, and then they're thinking about harming themselves. And some of them have attempted. And interestingly enough, Mike, I think we see a lot of our young people in the Richmond area are really at risk for depression and suicide intent. And so we're really trying to target strategies to address that population.
Right. Okay, sir. You got to put the nursing hat on right here. When people throw around all the time, I'm depressed. Now, maybe you are, maybe you aren't, but that's a medical term, and people out there would be diagnosing ourselves because you may be sad, you may be those things. Explain to our listeners the difference, like what is depression, and then it's just the other part is maybe just feeling lousy or not inspired.
So I want to talk about that. We do use that word very loosely,
Yes.
but depression is a clinical term.
Mhm.
There's a book we use, we call the DSM-5. It's the Bible of psychiatry, and it tells us what the categories are for true clinical depression. So that's what we use, myself as a nurse, Sarah as a therapist. And here are the warning signs of true depression. So I want to kind of highlight those. Feeling sad or withdrawn for a period of about over 2 weeks. So it's a very short window. So people, depressed for months and years. The book that we use, the DSM-5, says what? 2 weeks will qualify for simple depression. You can also have a person that is having changes in their eating patterns, changing in their sleep patterns. That's one of the things that we do an assessment for, to make sure that if there's any significant change from your routine, from those two things, that can indicate clinical depression. Also, we can talk about how the person behaves. Are they increasingly more irritable? Do they have more anxiety? And are they having problems? Even sometimes their physical health is deteriorating because of the depression. So we look at that 2 week period. We take a exhaustive inventory of what you've done. And then, of course, the worst thing is if a person is starting to having thoughts of hurting self. That's an ominous sign of danger, and that person really would need to activate a resource to support, because once that suicidal intent starts, we know the dark road that can lead to where people can act on those intents. So our hospital is here to support people in that crisis.
Are you seeing an increase, or what are the numbers as far as younger people? Younger people seem to really have been going through some things now. And a lot of times maybe they don't have the understanding how to express themselves. And, a lot of times we as adults be like, you'll be okay. Because back in the day, whether it was bullying at school, it was done at school.
Right.
Now that's just 24/7. There's no break from it. So as a parent, what are some of the things that you need to, or a friend or a loved one, what do you need to look out for?
Well, having those candid conversations with your children, understanding that when they are having problems, they're able to communicate that honestly, and then the parent being actively involved, because a lot of teenagers won't talk to you.
No.
So you have to be kind of a detective and investigate, see what's going on, maybe even push the conversation, because our children are experiencing a lot with social media and other things. They could be cyberbullied and no one will ever know. So it's really important for parents to really understand what social media things that they're using, having access to that as a parent, and then be able to activate a response if they're in crisis.
Here you go, Mike King here with the good folks from Poplar Springs Hospital. They're talking serious topics, but we got to give them a shout out. They are, Poplar Springs Hospital has sponsored the Colonial Heights Petersburg Chambers to come back to radio because it's important for what they do. So we just like to thank our friends over Poplar Springs for making that happen. You guys are a community resource, and it's about helping the community. From the nursing standpoint, let's talk about the whole COVID part. And are things getting better that you see out there? And what is Poplar Springs doing now? I guess it goes from week to week. It's day to day almost how we're dealing with this. Poplar Springs goes through a lot to make sure that the patients are safe, the staff is safe. Give us some words of wisdom, man.
So words of wisdom. We are seeing more people come back to the hospital for treatment. The good news is that there's more visibility and transparency about mental illness. When you think about the messages that are out there now, and maybe 10, 20 years ago, we didn't hear this.
I don't even know if it was 10, it might have been 5 years ago, because we didn't, there was a stigma totally tied to it. We talked last week with the military, it's like pull yourself up by the bootstraps, and it's a sign of weakness. Right. But now like you said, it is better. We're realizing it, maybe because the whole world got put on timeout.
Yeah.
Before I took time out, that's a character flaw. I'm not strong enough to keep it going.
Right.
But everybody was sent home.
Exactly. We have increased sensitivity to mental health. Our adolescents now have apps that they can activate when they are in crisis. Like they can hit an app with a number on it, or a coping skill that they can activate if they're in crisis. So our younger generation, they've really embraced the movement for needing mental illness, needing mental health treatment. And at a hospital, our numbers are increasing, but the good news is that we have greater transparency, decreased stigma. So it used to be a bad thing to come to the psych hospital to get help, but now with our younger generation kind of spearheading the movement, it's not a bad thing to come to the hospital. We want to help you. It's no longer a stigma. You can come out of the darkness and get help for mental illness.
There's so on Friday, a shout out to Chesterfield County Jail. We were over there talking to them about the HEART program, about how mental health, how drug abuse is all tied together and how it affects the community. And people don't realize that we didn't get help before, but now, so they say you would never not think about getting your, you broke a bone, that you wouldn't just go to the hospital because, what will people think about you?
Right.
But you guys are on the forefront of making that happen, making people aware and taking care of people. Let's talk about the process. I'm having an issue. We call up and we call Poplar Springs and we get Misty's group.
Yes.
Let's talk a little bit about what that means, because you were saying, if you got a problem, we are not letting you off the phone.
Correct.
So let's start with the crisis number.
Okay.
For Poplar Springs, our crisis number, if you're in crisis and you need someone to talk to, it's 24 hours a day. And then there's the process will start there. That crisis number is 1-866-546-2229. There will be someone there 24 hours a day manning the phone to help you through the process to where you have to go. They will position you wherever you have to go. So that number again is 1-866-546-2229.
Right. And then, so someone gets you on the phone, they'll do an evaluation on you, a quick kind of what's going on while you're calling. And particularly if you are really evidencing that you are a danger to self, you want to hurt yourself or maybe others, our team is positioned to keep you on that line until we do a handoff for you to get treatment. And that treatment will come through our hospital setting. So we have inpatient services. If people need that immediate treatment, we'll arrange for that. So the therapist will stay on that line with you and kind of transition you to that treatment. If it's the inpatient hospital, our doctors and nurses and social workers have an array of therapeutic modalities we use to support people in crisis and mental health.
So when people they leave the hospital, they're discharged, whatever, how important is the follow-up? It's just like, all right, I'm good. Thanks for coming. God bless you. It's not like that.
Well, the follow-up comes with us. Okay, so when there's a person that is stepping down and they don't need that inpatient hospitalization anymore, they will come to our partial hospitalization program. That's what they call the PHP. And that's where we start doing the monitoring, the follow-up, to making sure that they have those skills in place. And then having a group setting to talk about those skills and, practice those skills. Because to get those skills, and say you got those skills and don't practice them with, in a secure setting, then that's just, fluent, so that's what we have there. Then after that, we have the IOP program, which is the intensive outpatient program. So we are always following up. We have those licensed social workers, those licensed counselors to use what we call holistic approach.
And one other thing too, we partner with a ton of vendors in Richmond to do wraparound services. We have vendors.
When you talk about wraparound, explain to our listeners what
Sure.
wraparound services are.
So I have an adolescent that's in crisis. Well, the adolescent, there's a family behind them,
Okay.
right? So that family proper needs some level of education and continued support after they leave the hospital. So the wraparound vendor would visit the home, look at the medications, do therapy, talk therapy. We call psychotherapy is really just talk therapy, and they'll create a safety plan for their child in the home so that they can stay in the home and not come back to the hospital.
So, because if you don't treat the family,
you're going to lose the battle.
Yes, you're going, and that is the hard part.
And as far as the adults, we do the same thing. It's called case management. So we reach out to the emergency contact person so that we can put a safety plan in place, the person that provided the referral for them, so that we'll know their psychiatrist that they had before maybe, or their therapist that we had before, so that we can all have that holistic approach it takes a village, and to let them know that they are supported. That's the basic thing. That's the main thing. And when people are in crisis, they want to know that their feelings are validated and they're supported.
That is great. So now on the mic with Mike, we are the best business radio program around. I'm your host, Mike King. We're here with our good friends, Poplar Springs Hospital. They're talking about some serious things that are out there. We're talking, okay, so now you're saying people are in jeopardy of hurting themselves. Let's talk a little bit about, what you should do and some of the things we should pick up on. Maybe they might be subtle.
So I have some stats I want to talk through. This is through our NAMI website. This is how bad suicide is becoming for us as a nation. It's the second leading cause of death for people between the ages of 10 and 34. It's the 10th leading cause of death in the US overall. So just think about that. Those numbers are pretty sobering. And think about this one. 90% of people who die by suicide have experienced symptoms of mental health conditions, but there's 10% who we never capture. And we look at the media. Recently, some of the people who've been highlighted for suicide, a lot of them per se did not have a diagnosed mental health condition. It appeared as though they had everything going on. They had great coping skills and they were at the top of their careers, and yet they succumbed to depression and ultimately suicide.
And the sad part about that is there's no coming back from that, but when we look at it, we slow down, there were signs along the way that people didn't see, family members or other folks didn't see. So we have to sort of train each other or make people aware about what that is. You guys handle kids young people from which age?
We start at 11 to 17. And honestly, we see depression, suicide, anxiety disorders actually is a big one. A lot of our kids have tremendous anxiety going to school, obviously bullying, and the pressures of being an adolescent is unlike anything we've ever experienced. And they don't have the coping skills to deal with failure. When things don't go their way or they're not successful, they have breakdowns. And our goal is to give them the support they need so they can go back into the community.
On the mic we're here with Kent and Sarah from Poplar Springs Hospital. They're with us weekly on ESPN Richmond. This is part of the Mike King Radio Network, ESPN Richmond 106.1, 5 to 7 a.m. The Choice, which is Gospel 105.3. You're going to hear them on The Choice as well, talking about this because it's very important. And we're there from 2 to 3 every day, as well as International Business Growth Radio. Poplar Springs is really tied to the community too. Let's talk about that from a community aspect. Clearly you are, because you sponsored the chamber coming back. I mean, if there's anything more than that, is helping out the Chamber of Commerce, which is sort of the backbone. And here you guys are propping up the chamber.
Yes. We have a partnership also with NAMI. NAMI stands for the National Alliance of Mental Illness. It is a national organization and a local organization. I think it's the CBH in Richmond. CVA, NAMI, and they do a tremendous work about educating families about where to go. What do you do if your child has a first schizophrenic break? What if you have a psychotic break? What do you do for resources? And they are a national organization, and we have a partnership with them, and we're actually on their website. So we're linked to them, knowing that they can give hope to the people.
One of the things we talked about, so I was just over with the sheriff from Chesterfield County, shout out to Sheriff Leonard over there, about the part that drug abuse, mental health play in the criminal justice system. Before, police would just show up. Now it's like you need to have somebody come there who has a background in that right there. Let's talk about from a policing standpoint, how important that is to talk to somebody when they're in a moment. If I saw I always joke that said no one has ever calmed down by telling them to calm down.
No.
It's going to take you the other way.
Exactly. So police use a training called CIT. That's called Crisis Intervention Training. It's a national level of training to help them to sensitize them more to mental illness. So when they see something in the field, they don't respond to it with an automatic, the way it can go in a violent way. So this helps police to understand, recognize, and then seek places like Poplar Springs or the emergency room to give that person help. So it's called CIT, and it is being embraced nationally in police departments.
That's good. So Poplar Springs has, you said, other partners and vendors who help you with this from a holistic approach, because what you do, like you said, we're working with the child, but the child has a family. That's very important. So as we wrap up here, it's Mike and Sarah and Kent talking about the great things happening at Poplar Springs. Let's talk about support from family members and friends about how to support someone going through something.
It's very important. That's why we do a safety plan when they first come in, because not only is it important for the therapist that's working with an individual, because they might want to go through something during that time, but it's also good for that patient to know who they can support, who's there to support them. And so we do that for the support system. And not only that, we have someone there that will talk to them on an individual basis as well. So that's very important to have your support system written down so they know who to call.
And in the inpatient setting, we do something called family therapy and group therapy. So we get the family member, because of COVID, sometimes we use electronic means like Zoom, but we include the family member in the treatment team. We cannot treat the child without understanding all the factors that impacted the person coming to the hospital. So that member is very important for us. And we put them in the family therapy trail so that we can track them and make sure that they have good outcomes when they get discharged.
All right, Mike is here, Kent is here, Sarah is here from Poplar Springs Hospital. If someone had told you from a medical standpoint some years ago that you'd be able to do this thing with Zoom, what would you guys have said?
Well, Mike, I appreciate that because of where I'm from. I'm from like the very rural area. And there's a lot of mental illness in that area. People don't, and it's low socioeconomic.
Okay.
So there are people that don't have cars. They don't have a way to get back and forth, and they need this. Right now, I have like 3 of my patients that have lost someone through suicide. So that suicide act affects a lot of people. So now, working with these people, because they're trying to understand. So I appreciate telehealth, the Zoom, because we can get to those people that can't get to us. And we provide a safe environment for those people.
Because before we'd have thought that telehealth didn't work. I interviewed the president of Elephant Insurance and I asked him, what were you so shocked about as far as business goes during the pandemic? He said that, the commuting, just working from home would work. He goes, I was 100% saying it won't work. And he said, you know what I did? He said, I learned it works because all of a sudden you're able to create relationships that we didn't think that I can't get to the hospital, but all of a sudden I'm able to get to, the doctor can come to me, the nurse, and you can check on people a lot easier. It's not as good as sitting there holding hands with them, but it really opens up the avenue of how can I get 30 miles to a facility, don't have money, don't have any of the things that I need. It's enough that we have an internet connection. That's a part. That's a part too, but it is better than nothing. Mike is here. We're with our good friends, Poplar Springs. How can people find you one last time? Parting words. You got anything that you got to leave?
So I want to say this whole thing about suicide, again, I appreciate being here today. I want to talk about it. You can get help if you're hurting, if you have those thoughts of hurting self, if you feel depressed, like I mentioned, changing weight, things that in your thoughts that you feel that things aren't right, please give us a call. We have a ton of resources for you. If it's not the inpatient setting, there's outpatient settings, there's resources. We are available, and use and activate that number. Poplar Springs is here to help the community.
Poplar Springs helping the community in more ways than one. It's on the medical side, but also supporting the community through the efforts. I know you guys have a bunch of people who are Rotarians. United guys, look at them smiling over there. I see it.
I was going to bring that up too.
That's you know what they are. So, you're doing a lot of things to support the community as well as supporting the chamber efforts. We'd like to thank them for it. On the mic with Mike, it is the best business radio program around. We go to places people don't go to. One day we're talking to the Down Syndrome Association. The next day we're at the Chesterfield County Jail. We're coming to you today from the Common House. We're going to start coming to you from Poplar Springs. At that place, everybody's talking about the Grove. So we're going down there to figure out what exactly they're talking about. So on the mic with Mike, we'll be back the next time. We're going to try and do it better than ever. Thanks now. Take care.
Right.
All right.